Roy Lilley's here, former NHS Trust Chairman. A&E patients can account for almost 1 in 7 visits if they've been there before. So I guess an awful lot of people continue to go back like a sort of merry-go-round, unfortunately, probably because they can't see a doctor. And 2/3 of the NHS workers who have apparently been surveyed recently have considered leaving the health service. Very good morning to you, Roy. I mean, one of the problems we have here, the government's talking about cracking down on people who are off long-term sick. Seems to me there's an awful lot of people off from the NHS on long-term sick, apart from everything else.
The long-term sickness rates have gone up in the NHS, Mike. That's right. The number of days sick has really accelerated. Mostly it's after COVID. I think, you know, it's quite interesting. I've been watching the COVID inquiry, and when you listen to the testimony of people who've been actually working at the front line, the sharp end of healthcare during COVID, they've had a horrendous experience. They really have. I mean, the NHS is used to dealing with people in extremis. They're used to dealing with sort of messy things. They're used to dealing with all the kind of stuff that we don't want to see. And we're used to dealing with death. But when it was on an industrial scale, like it was during COVID, a lot of, particularly the youngsters, they've just not got over it. And I think it's left a kind of fingerprint on their soul and will for the rest of their professional lives. So COVID has had a lot to do with it. There's no question about it. As for the other issues of sickness, the NHS has always had high levels of sickness, higher levels of sickness than other public services, mainly because of the nature of the work. I mean, a lot of them get assaulted, which paramedics particularly. Yeah. There's a lot of lower back pain as well amongst nurses with lifting and what have you. So the sickness levels are generally higher in the NHS for reasons that we can sort of understand. Right. But it's been exacerbated by COVID. There's no question about it. Yeah,
no question at all. I mean, do you also fear that COVID has cast a shadow over the NHS in total? I mean, not just in terms of the personnel, but just in terms of the way things are done, because it did more or less shut down as a service for an awful lot of things other than COVID for about 2 years. And I wonder whether it's not recovered from the sort of administration problems from that.
No, Mike, you're absolutely right. I mean, we forget that before COVID, the NHS was running waiting lists at about 4.5 million, which was a record at the time. Yeah. It had about 40,000 vacancies, mainly nurses, which was a record at the time. Along came COVID, and of course, you know, the government threw money at it. Nobody really understood what was going on. It was a nightmare to work on the wards. We came out of COVID the other side, and of course the chickens have really come home to roost. Before COVID, we had 10 years of flatline funding, under 2%. The NHS needs 4 just to survive. And so the chickens have coming home to roost, and it's never really recovered. I mean, the great bow wave of demand that was saved up during COVID, with people not, as they say in the NHS, presenting with their symptoms, that means turning up, seeing a doctor or what have you. And now the waiting lists are at 7.5 million. That means there are about 6 million people, because some people have more than one thing wrong with them, but there are about 6 million people on the waiting list. Now, if the NHS is going to get back to the 18-week target, which is what Wes Streeting wants to do by the end of this Parliament, it has to get the waiting list down to 3.5 million. The NHS can manage with 3.5 million people on the waiting list and still see them in 18 weeks. That's the flow character, what we call the flow characteristic of waiting lists. That's how it's happening. The problem we've got now is we've got as many people coming off the waiting list as we've got coming on the waiting list. The last time I looked at the difference, it was about 1,000 people fewer. So the demand has gone up. There's a great sort of pool of demand that the NHS is chipping away at. It's had some success with the long waiters, but the demand is still there, and there's not enough capacity. I keep coming on, and you're kind enough to invite me onto your program in the mornings, and I talk about capacity. You know, what does it mean? Well, it means we haven't got enough people and enough beds to look after everybody.
And that is part of the massive problem. But there we are. Listen, I've got to run because I haven't got much time this morning. Roy Lilley, former NHS Trust Chairman. Meanwhile, we discover, though, that the NHS has got a £330 million contract with an American company called Palantir, which is a CIA-linked data mining company, which has just employed Lord Tom Watson in some kind of paid capacity. I mean, beggars belief how much money's flooding in and out of the country. Absolutely incredible stuff. Let's talk